in general, they're very effective treatments for panic disorder. I think one of the main reasons that I have a little difficulty, I try not to use them if I can help it, is especially if the person is going to do the therapy, the cognitive behavioral therapy. What did I just tell you was our technique is in the therapy. The technique is to teach the person that this isn't a dangerous thing, right? But if I give the person a Xanax to take every time when they start getting their heart rate up, and they have to take a Xanax right away, that sends them a message that the doc doesn't want my heart rate going up. He thinks that's dangerous, so he's got to give me a medicine to make it stop. That's not the message I want to send. I want to send the message, it's okay, your heart rate's going to go up, you're going to be fine, In the long run, that's a lot better message to teach the person, because then they keep it with them and they have a lot less trouble with, the panic attacks coming back.
Part of the problem with Xanax too, though, the treatment unfortunately becomes one-dimensional. I take a pill, that's all I have to do. And it interferes with learning new tools.
Yeah. That's the other thing that I guess I'm getting at, is that it sort of short circuits the psychotherapy a little bit. And I think the psychotherapy is real important for this. The studies show that it's, for the long run, it's a very important thing. So, yeah, I mean, the question was for the tape. The question was sometimes the medicines will, sort of like what I said. Send a message that that psychotherapy is not necessarily as important. Just taking the medicine is good enough, and it's probably the wrong message, I would think. So. Good question. Good comment. I think I've covered everything on panic disorder now. Does anybody have any questions about panic disorder? It's been almost the whole time on panic disorder. I'll try to go through generalized anxiety disorder quicker. No questions?
Is test anxiety and stuff like that, is that considered under panic disorder if a person has test anxiety often?
Test anxiety, is it the same as panic disorder? Is that what you're asking?
Well, is it a panic disorder, I guess?
Probably not. If it's mainly just around the tests, then again it's more related to tests. I don't know that I'd call it a phobia necessarily. I would say it's common. I mean, it's a common thing, and it's sort of how the person's wired, how they're made. Some people tend to be a little bit more perfectionistic and want to be very good at something right away and this kind of thing, and there's they put a lot of pressure on themselves when they go to take a test. Pressure like, how am I going to do? I hope I don't mess up, these kind of things. But other people just are sort of more laid back in general, and they're able to approach the test with sort of the attitude like, well, I either know or I don't, And those folks, and the hard part is those folks tend to do better even if they don't know the material as well. Because the anxiety sort of interferes with your ability to sort of sit and rationally think through the questions and go quick enough. That's a tough one, and I sort of, I'll tell you, I don't want to digress too much, but we put so much emphasis on tests, and I don't think that's such a good thing. First of all, I think we're sort of expecting every single brain to work the same way, and I don't think that's accurate, and I don't think we should say somebody whose brain doesn't work well with the standardized test is not smart, is not an intelligent person because they're flunking out. That's not probably the case. In general, we don't, our brains, we as humans, we don't learn the way, unfortunately, I don't mean to cut off schools or anything else, educational systems, but the way the educational system works, I think, is not really the way the brain works. I mean, the brain sort of works think about infants, How do they work? They do what's called hypothesis testing, right? Well, I wonder what happens if I stick my finger in this socket. Bzz, well, that wasn't so good. I think I'm not going to do that again, right? How do you teach like that in school? I don't know exactly, but if there could be a way to do that, that's kind of how we learn. All of us learn, right? I mean, as adults, it's kind of refreshing. We get out of school and we can kind of get in the job and do our own, do our jobs or whatever it is we do, and how much time do we use? Some of the stuff we never learned before, but we figure it out sort of on our own in a way. And sometimes that stuff that sticks with us better than stuff that we tried to rote memorize out of a book somewhere. So it's a challenging thing, and the problem is again that the brains are also different. A lot of us are different. Some of us do real well with standardized tests, some of us not. It's hard to really. You can't just have a teacher for every child. That's the problem. We digress a little, but Anything else? Those are all, I mean, I welcome any questions like this. This is good. This is getting you all thinking about the brain. That's good.